Hello, my name is Patrina Brown, and this is my audience, my friend and co-worker, Jessica. My topic is breast cancer. Breast cancer is a disease characterized by uncontrollable overgrowth and abnormal malignant cancer cells that form in the tissues of the breast. There are various types of breast cancer. The types are determined by which cells in the bloodstream are cancerous. In its entirety, breast cancer is a major public and global health problem. It is deemed as the most common cancer among women and contributes to a significant portion of illness, healthcare expenses, and loss of life. Risk factors. Main factors that influence the risk of acquiring breast cancer is gender, mostly women, and elderly age. Most breast cancers are found in women at age of 50 and older. However, studies do show that your risk of breast cancer is related to a combination of factors, and some women will develop breast cancer even without any other risk factors that they may have knowledge of, according to the Center for Disease Control and Prevention 2016. Therefore, it's imperative to consult with your physician about ways or methods to lower your risk of developing breast cancer. Risk factors, to name a few, include personal history of invasive cancer, lack of exercise, overweight and obesity after menopause, dense breasts, hormone replacement therapy, family history, and drinking alcohol. Statistics. 1 out of 8 women will develop some form of breast cancer in a lifetime. This disease is mostly commonly diagnosed in women, and approximately for 15% of all cancer deaths in the United States. National Women's Health Network reports that the incidence of breast cancer for Latino is lower than Caucasians or African American women. Annual data reveals that 70 out of every 100,000 Latino women are diagnosed with breast cancer, opposed to 112 out of 100,000 Caucasian women, and 95 out of 100,000 African American women. Studies show that African American women carry a lower incidence of developing breast cancer than Caucasian women. However, their rates increase once they reach the age of 40. Warning signs. In general, people of all races have different symptoms of breast cancer. Some people may not display any symptoms at all, as a person may not discover a diagnosis of breast cancer until after they have a mammogram. Some warning signs, to name a few, for breast cancer include a new lump in the breast or in the armpit, a change in breast size or shape, redness or rash on the skin around the nipple, a discharge from the nipple other than milk to include its blood, thickening or swelling in the breast, irritation or dimpling of the breast, and pain located in any area of the breast, according to Pierce 2016. Diagnostics. Diagnostics are used to screen for and detect breast cancer, include having your annual breast exams, mammogram, which is x-ray of the breast, ultrasound, a procedure characterized by high energy and sound waves bouncing off of internal tissues and organs, making echoes that form pictures of those tissues. MRI is a magnetic resonance imaging, a procedure that utilizes a giant magnet along with radio waves and a computer to generate a series of detailed pictures of both breasts. Blood chemistry studies, a test in which a sample of blood is analyzed to measure and determine certain substances released in the blood by organs or tissues. A biopsy is the extraction of cells or tissues for analyzing under a microscope by a pathologist. Treatment. Appropriate treatment for breast cancer solely is based on the type of breast cancer and depth of the metastasis, which is the spreading of the disease. Clients with breast cancer frequently experience more than one type of treatment. Multidisciplinary teams comprising of surgeons, medical, and radiation oncologists collaborate to provide the most optimal care in the fight against breast cancer. Treatment options are as follows. Surgery, procedure where physicians make an incision to remove the cancer cells. Chemotherapy, a procedure where medicine is used to shrink or eradicate the cancerous cells. And a drug that can be formed into pills or administered intravenously, which is through an IV. Hormone therapy aid in blocking the cancerous cell from damaging the hormones that grow the cells. Biological therapy works with your body's immune system to fight against the cancer cells. Radiation therapy is a procedure using high energy X-rays similar to X-rays to destroy cancer cells. And mental health. Studies have shown that clients will experience psychotic disorders such as anxiety when exposed to genetic testings. In summary, breast cancer treatments can be disfiguring, painful, and costly. Therefore, identifying tumors that actually pose a threat can focus therapy where it's needed the most, thus saving millions of women from potentially harmful interventions. Each case of breast cancer is different, as well as each cancer client's immune system. Therefore, it is imperative to match the right treatment with the right patient, a defining challenge of the future. Knowing which women are susceptible to breast cancer and why could enlighten root causes, leading in new prevention and treatment approaches. And as you can see, I have several references listed down there. Any questions, concerns?
No, this is very informative. Thank you.
Thank you so much, and thank you for listening.